Good evening, everyone. My name is Charlotte Brown, and tonight I'm presenting a grant proposal for the Know Your Pressure program. To start off with, I'm going to go over the components of the program. The main component is a mobile health app where participants can take and monitor their blood pressure at home. They are supplied with a blood pressure monitor. They take it ideally 2 to 3 times a day or as much as needed. And they also receive notifications on the app during the week. Notifications are education about blood pressure, about physical activity, and heart healthy eating. Now, the app is to be used between doctor's visits. So at the doctor's visits, there's provider education received, so the doctors talk to the patients about healthy blood pressure, what it is, how to maintain it. And they also give them education about anything that they might need to know related to it, identify patients at risk for hypertension, and all of them can be enrolled in the Know Your Pressure program. So the idea is the self-monitoring of the blood pressure, automated education notifications. They can track diet and exercise. The goal is improve clinical outcomes overall and to support the patient in self-management and care between appointments with the goal of improving blood pressure readings. I didn't mention that we also do screening events once a month, and there we go in the community in various locations and we meet the community where they're at to provide a service and just see what the needs of the community are as far as knowing their blood pressure, any questions they might have about it. We hand out educational materials as well. Okay, I don't have much time tonight. I'm going to be going over these slides rather quickly, so if you have any questions, let me know. The target population for this intervention is the young adult population in Philadelphia, Pennsylvania. Hypertension is a problem for many. When the blood pressure gets above 120/80, it's elevated, and beyond that is considered hypertension. The rates of hypertension are increasing in the young adult Black, non-Hispanic Black population in Philadelphia. And hypertension often goes undiagnosed or uncontrolled in many people. Some other information about hypertension: it may lead to pregnancy-related complications, death, coronary heart disease, stroke, heart failure, and end-stage renal disease. There's a lot of money spent on these conditions in Philadelphia. It's higher than the national average. So a lot of money is spent on managing this condition of hypertension. And the goal really here is to prevent it and manage it effectively so that it doesn't lead to chronic conditions. Now, cardiovascular disease, including hypertension, is among the national health goals to promote health equity for healthy people 2030. This is a chart of the effect theory. It's just a flow chart that shows how this program addresses the problems of hypertension, diets high in processed food, lack of physical activity, unknown hypertension, and how that can lead to poor health outcomes. Now we're talk about community engagement. It's very important that the community is engaged in all phases of intervention, assessment, design, implementation, evaluation. And so these are some of the reasons that it's very important. Helps build trust, accuracy, and success, and leads to overall improved health equity. So here we have some examples of how the community is engaged in the implementation of the intervention. In the health app, it's available in multiple languages. There's culturally relevant food recommendations. The app clearly states what is done with the participants' data. The whole process is very transparent. And then even in the blood pressure screening events, we meet the community where they're at to really engage with them and try to understand the extent of the problem so that we can address it appropriately. So here I have listed some ways that community engagement is involved in the evaluation phase of the intervention through data collection. For example, things like questionnaires, surveys, focus group, so that we can really get feedback from the community on what we're doing well, what we need to improve in. And finally, the final evaluation findings will be shared in a public community forum to ensure transparency. And that way we honor the participants' role in shaping the program's direction. Right here we have the logic model. It breaks down all the inputs, outputs, short, medium, and long-term outcomes of the intervention. So for example, if we have an input of supplying blood pressure monitors, then the output is self-monitoring of blood pressure at home for the program participant. Short-term outcome is the blood pressure is known, medium is patient is aware of blood pressure, and then the long-term desired outcome is that we have hypertension prevention and management. So here we have our 3-year budget. We were able to stay under our budget for the 3 years, which was a great accomplishment with all the things that needed to be done. And so each year we stayed under $100,000, which helped us meet our budget of $300,000. If you notice, the first year, the startup costs of the mobile app were a lot more than the maintenance fees for the year, so that allowed us to reinvest money into the equipment and other aspects of the program for the next 2 years. So one of the things that's so great about the Know Your Pressure program is that it has built-in sustainability. We had a projected surplus of over $36,000, which we did meet, and we were able to reinvest that into the next 3 years of the program. We did also make money off of licensing the program out to insurance companies. Since we had such great results, we had an insurance company that was interested in that. So that also gives us money to reinvest in the next 3 years. And even though both of those things are wonderful, we still need the grant from the Healthy Community Foundation, which we are asking today to continue to make an impact on the community in advancing health equity. So in conclusion, the Know Your Pressure program is a very effective way to meet the goal of improving health outcomes and health equity. Many community members are unaware of their blood pressure, and through this program we can empower them to know what their blood pressures are and have effective ways of self-managing blood pressure, leading to better health outcomes and advancing health equity, which in the long run is better for everyone, which is the goal here. So I thank you for your time.